Today is Victory in Europe Day.
Just as I have a dream.
A salute from Mr. Nelson Mandela.
And Mrs. Thatcher.
The biggest news stories of 2020 have continued to dominate the news cycle. Today I'm joined by my two fellow co-hosts, Rachel Duffy and Samuel Moore, to discuss coronavirus responses around the globe. Which country responded the best? How's the UK finding itself in the mess that it is currently in? These are all questions which you guys will find out the answer to later on. Before we start, however, I'd like to remind you to subscribe, like, comment, and share Systems Reimagined's videos if you do enjoy them. And with that being said, we'll have Rachel breaking down kind of the timeline, the UK's coronavirus timeline for us, and giving the timeline into how we got into the situation we're currently in.
Okay, so another grave milestone is being reached today. A further 413 deaths have been recorded, with 58,784 new confirmed COVID cases in the past 24 hours. So although to many of us these statistics are just coming to be more and more expected, they really are huge figures in our second, third wave that we're now currently in, and are leading to a huge strain on the NHS and onto schools and other public sector services, which I'm sure we'll get into further on. But to go for a brief recap of what we've seen so far with the UK, we saw the first confirmed cases in March. The government quickly abandoned a contagion strategy, and also they abandoned a herd immunity strategy, which was very controversial at the time when Johnson came out and said that that was perhaps one of the best ways to deal with the crisis. But it's something that's kind of keeping recurring, but I think everyone agrees that the abandoning of that policy especially has been a good thing. In March, we also saw the beginning of the national lockdown. And then across March, April and May, there were just a lot of calls for personal protective equipment, PPE, to be more widely available within the NHS, within care homes and social services. There was also pressure on the government to provide an effective test, track and trace system, because that is what happened, especially in South Korea, but in a lot of other countries. And that was one of the biggest ways other nations were able to tackle the virus. So during this initial lockdown that I'm sure everyone will remember for kind of being the days of baking banana bread and the TikTok iced coffee trends and things like that, the government's main strains were the providing of PPE and an effective test, track and trace system. So we then got to the beginning of June, where we saw a summer opening up period with travel doors and travel corridors to other European countries and encouraging summer holidays and vacations. With hindsight, this probably wasn't effective, considering that we'd only kind of brought in travel restrictions and quarantine periods ourselves not much sooner. Other countries, not just in Europe, but around the world, were having stricter quarantine periods, and that, I'm sure, among many other issues, is something we'll pick up on later. I think also one of the biggest issues with the summer period and that kind of slight return to more normality was the Eat Out Help Out scheme. Rishi Sunak, the Chancellor, I was going to say then Chancellor, he still is of course now the Chancellor, but he had the idea to give, I think it was £10 off per meal, or certainly 50% of the bill up to £10. Now, as good as this was at the time for people wanting to kind of go out and see their friends, it not only had a weaker economic impact than had been expected, with small economic growth compared to the levels we should have seen, pandemic or not, giving away money for free basically. It also, and a lot more damagingly, had a negative effect on people's health and was one of the one of the things that resulted in the second wave. So as we're kind of going to the end of summer, this Eat Out Help Out scheme, for example, but also the return of schools and universities caused a second wave. We again saw immense pressure on the NHS. We're also starting to go into that winter period then in October, where there's more kind of common colds and flus and pneumonias with an ageing population. So it's a time of great strain anyway. This was only accelerated by the virus and the kind of normality that we saw over summer. So there were calls in October and November for a national circuit breaker lockdown. We saw some of the devolved nations doing similar policies, Scotland, Wales, Northern Ireland, and eventually Johnson bowed to pressure, and over November we had a short snap circuit breaker lockdown. We then came out of this, and just to summarise the past month, although I'm sure we're maybe even more aware of that, fresher in our minds than some of the events in March, there was initially plans for Christmas bubbles where you could mix with 3 different households anywhere in the country for 5 days over the festive period. This was then cut short with parts of London and the southeast having to go into Tier 4, which is the closure of all non-essential shops, leisure facilities and gyms. And this was a result, I'm sure we'll be aware of the new strain, which is much more infectious of the virus. This again was cut with people then being encouraged not to mix at all over Christmas or New Year. And really, to summarise, Johnson is giving a speech tonight at 8 p.m. and I think most people are pretty much expecting him to announce another national lockdown with a very kind of prevalent stay-at-home message, very similar to what we saw in March, work at home if you can, and the possible closure of schools and universities again, which the government have said on many occasions is a real kind of last-ditch worst case scenario event to close those educational institutions. But without further ado, I'll pass to my co-hosts and I'm sure we can kind of unravel that. I just wanted to provide a bit of a timeline and see just from a UK perspective how we've dealt with the crisis.
Yes, that was great. No, really good summary there. Yeah, I mean, there's also things like, so just I think one thing which you forgot to mention, which probably is worth mentioning, was the Nightingales being built, which, yeah, I mean, huge project. I think it was £230 million. But with that being said, as we're now facing this kind of larger wave, it seems, these are not really adequately funded in terms of staff being there and stuff like that. So another kind of taxpayers' money wasted. And I'm sure Sam can kind of discuss a little bit more with the outsourcing of test and trace to Serco and that kind of failure with regards to leading to a second wave and I guess a third wave in some sense. How we've just seen the government really lit a lot of taxpayer money on fire during the pandemic, and that's just an example of that. What else? Oh yeah, Eat Out to Help Out is another interesting one. I believe the study was done that showed it was 1 in 6 people who got infected with coronavirus in the second wave. It was because of the Eat Out to Help Out scheme, which is massive amounts of people. And also, when you said the former Chancellor of the Exchequer, Rishi Sunak, I was like, I wonder in how long that will actually become a reality, because I don't think didn't do too well in that time period in between the first and second wave with regards to economic growth. What else? Locking down too late with the second wave as well, as you mentioned. It's we got advised by SAGE to lock down or do a circuit breaker weeks before the government actually decided to do it. And it seems like this is a recurring theme with Boris Johnson, where you'll have government advice, science advice essentially, which is given to you, and then he doesn't follow it. He waits until the last moment. Then when it doesn't seem like there's any other option, he decides to do a lockdown. We get huge amounts of deaths, huge amount of cases. And to be where we are right now, 57,000 cases on the 2nd of January. Today we had 58,000 cases in one day. We've had over 50,000 cases since the 29th of December. So in terms of cases, it's massive. And in terms of deaths, we're at over 75,000 deaths now, right? So these are numbers which are horrendous and which definitely could have been reduced, if we've locked down earlier the first time, the second time, and I guess now the third time. I don't know if Samuel has anything else to comment on it.
Yeah, I mean, I think you both summarized it pretty well. But just like, from the beginning of the outbreak and the COVID, the complete, lack of proactiveness within the government. The government is always late to make decisions and take proactive measures to address, the ever-increasing cases. But I think from the first wave, I can kind of understand, the lack of action because, it's a new disease. We weren't fully understanding the extent and how it works. So I think to some degree you can give them some sympathy for that. But, throughout when we initiated the first lockdown, I think it seemed like to me there was no introspection from the government and how, we can attack this and improve this further. Once we out of this lockdown and how we can properly track and trace, for example, how we can, mobilize to just to make it more effective in dealing with this crisis. But it seemed like no lessons were learned. As you said, the disastrous policy of Rishi Sunak for Eat Out to Help Out, just basically giving money, like subsidizing more COVID cases, which is crazy to think about nowadays. And it just a complete reactive policies and there's no proactiveness, as I said. So yeah, and also as you mentioned, Benjamin, about the outsourcing. I mean, one common thing that I find with the countries who have dealt with this successfully is, they understand the power of the state to mobilize and effectively create change and effectively combat the crisis. So yeah, I just think the outsourcing in the UK just created a complete decentralization and a complete mess, and it didn't allow the UK to actively address this issue effectively. And yeah, just a complete disaster. As you said, outsourcing to Serco, it just wasn't effective, but I guess that's ingrained in how the UK, the British society is, But yeah, just overall disaster, and I'm sure you might get into that now a bit about the schools, and how that's been dealt with recently. The National Education Union recently put out a statement, calling for a strike and not going back to school, and I definitely support them, because I read in the Sage report recently that from September we saw with the introduction of the new strain, there was a 50-fold increase from 11 to 16-year-olds in getting coronavirus cases. But yet we sat on this information for months, and only until a week before December, when I think the schools made a reasonable request to maybe shut down a week earlier, because Christmas is the time where there's a intergenerational mix, especially when bars plan to open it up, So I think it makes sense to maybe give a week of as minimized interaction as possible. But then once they try to do that, then the government sued them for even trying this. So I just shows from the beginning to where we are now, it's just been a complete lack of dealing with this properly, the lack of enforcement of the state and mobilizing the state, disorganized outsourcing, the stupid Eat Out to Help Out policy, just so much blunders. So yeah, I mean, as we'll see later on with the other countries, I think we have examples now that show that there are successful ways and there are commonalities within countries and how they've dealt with this crisis. And it seems like the UK hasn't learned from that.
Yeah, and in a lot of ways, that's what I find kind of the most insane about the UK and its kind of responses over the last, second wave and third wave, is that after the first wave went around globally, we had examples of what worked well. I mean, everyone spoke about South Korea, for example, at first, but now we have New Zealand, we know, has worked well. We know that Australia has worked well, as we'll get to later on. And so, yeah, that's what I mean. It's just kind of unbelievable how after, all this time, we know there are some places which have performed better in terms of lives saved and economically than the UK has, yet they're still late to respond and things like that. But yeah, coming on more to unions and stuff like that, because this is kind of crazy how, there's been a lot in the news recently because Brexit deal obviously going through is a big kind of news story to discuss. And maybe we'll speak about it a bit later, but I kind of feel like the media kind of apparatus in the UK used the Brexit deal as a form of buffer from scrutiny against, the increases in coronavirus cases. But anyway, we'll get to that in a second. But no, now we're also kind of hit with a lot of news with regards to unions. So as Samuel said, the NEU, informed 450,000 staff to not return to school because they said it wasn't safe. This is backed up by Sage reports. In one Sage report released 22nd of November, it says it is highly unlikely that measures with stringency and adherence in line with the measures in England in November, i.e. schools open, would be sufficient to maintain the R below 1 in the presence of the new variant. So R below 1 obviously meaning, the pandemic would be shrinking, and R above 1 meaning that it would still be growing. There's other evidence pointing towards it, which I'll put up on screen, just so everyone can have a bit of a look at some of this, some other reports such as the Child Task and Finnish Group, which is about, again, student-teacher transmission. And there's an important point to kind of debunk here in some ways, because, people often try to say that, there's no transmission between children and also teachers. But if you look at actually the data behind it, it shows that, the cases in teachers and also the cases within the school children, like the population essentially, like primary school, secondary school, they're like really highly correlated with one another. Obviously, correlation doesn't mean causation, but we can see when things like infection rates in teachers and students dip when kids go on half-term break, for example. We can see that's kind of some form of evidence, right? That there is a correlation there, obviously. But yeah, and the union's demands as well have also not exactly been too crazy, right? Like all they're trying to say is that it's not safe to return to school. Therefore, what we should do is we should prepare teachers to work remotely and to volunteer if they want to go in for to take care of kids essentially who whose parents are, or one of their parents is an essential worker, right? That doesn't seem too out of the ordinary or crazy to me. Quite sensible in my opinion. And yeah, I mean, I think it's just, again, I support the unions, and also, there's a important point to make here about the lack of support from labor with the NEU and other teaching unions trying to come out here. Because if Keir Starmer and Labour wait until today, the day that schools go back to say, oh, we support unions, they're not really doing too much, right? Keir Starmer could have had a leading front in trying to, fight the Tories on this and be like, look at all this evidence, we support unions. But in reality, I feel like that isn't really the approach Labour is going for right now with under Keir Starmer's Labourship. They're much more for, more big money donations as opposed to, supporting union and getting more grassroots support, right? So again, more in line with Labour politics right now more than anything. But yeah, anyway, I don't know if you guys have anything else to add with regards to unions.
Yeah, I think on the point of Starmer waiting until today to come out in support of those, it's certainly worth mentioning that although we're highlighting a pretty disastrous track record of the past 9 months of COVID, it's not meant to be a kind of Tory bashing thing, but those statistics do speak for themselves. But equally, Starmer and the Labour Party have not been an effective opposition. They have had every opportunity to really kind of hold the government to account and scrutinise them effectively, with the failure of the PPE deliveries, for example, that we saw in kind of April, May time with, as you mentioned earlier, Benji, millions of pounds of taxpayers' money going on faulty equipment, with Eat Out to Help Out, with a much too accelerated return to kind of economic growth above saving people's lives, and they have time and again failed to do this. Starmer has had some redeeming moments. He's made some good addresses at Prime Minister's Question Time. Some of his lines do still really ring true with Boris's kind of dither and delay strategy. But overall, the Labour Party could have really capitalised on the pandemic and used it to their advantage, being on the side of workers and teachers and the unions, and really just, highlighted the really, really dangerous and damaging narrative that the government have been peddling, but they haven't done this as effectively as they should have. They are not leading in the polls to the extent that we would expect them to. If you look at other countries that have had similarly bad COVID responses, their opposition parties have really been able to capitalise on this. So I think while we're kind of highlighting some of the major shortcomings of Boris, of Sunak and other government ministers, it's by no means to say that the Labour Party would have done a much better job in government, although it's hard to do a worse job, certainly. I think we do have to just mention here, in the kind of balance of fairness, that with hindsight it's easy to go on these things, and it's very well saying Johnson kind of critiquing Starmer, calling him Mr. Hindsight. It's difficult not to use hindsight in a scenario like this, but also it's difficult not to kind of come out in support of unions as the leader of the Labour Party. So yeah, I don't have much to add on the union front, just obviously that they do have the teachers, and not just teachers, but all school staff's best interest at heart. But whether the government will listen to them is kind of, it waits to be seen.
Yeah, I mean, going back to what you're saying, Rachel, I mean, yeah, alongside, oftentimes being the insufficient opposition to the Tories, there's also just a lack of, other, like, their own ideas, to address this crisis, It seems like more or less like Keir Starmer just refusing to, take the line of what Boris Johnson's saying, but he's still not offering his own ideas. And I think that's, I think that's a big mistake on him, and that's one of the reasons why I think that, they haven't seen a bump in the ratings over these past few months, or at least not as much as they thought it would be, So, yeah, I agree with you. I think there is definitely the opposition hasn't been as good as it could be, and there's been a complete lack of imagination from the Labour Party, and yeah, and I just hopefully, yeah, I mean, it's still to be seen, how. This is for another time, but also I wonder how, once this crisis is more or less, calmed down, how's Starmer planning to, separate himself and, express his own ideas for the Labour Party and his vision, because we haven't seen much of that now. So, yeah, I mean, that's a discussion for another time, but yeah, definitely, it's been quite a poor opposition, I think, up until now.
Yeah, no, yeah, definitely. So should we get into the compare and contrast, I guess, or kind of looking at other countries' responses? Obviously, we've just gone over the UK's response. If you guys want to add anything else, then, speak up. But if not, then we can, move on. So I believe Samuel's going to start us off with China, where the virus emerged, and then go to Vietnam. Then we're going to look a little bit at the Pacific, and then Samuel's going to end us off with Cuba.
Wait, Rachel, I thought that weren't you doing China? I thought you were gonna do China. Yeah.
Oh, sorry, my bad. Rachel, then. Rachel, I think you might be on mute.
Yes, I was. So going to China, where the virus originated from, it's certainly divisive. Everyone will have an opinion on how they think China have handled the pandemic, or where they think the pandemic came from in China. At the minute, the narrative is that it was from a wet market, which is a very plausible explanation, seen as animal agriculture and society's kind of meat consumption has a positive correlation with these viruses and pandemics. But we won't get on to too many of the conspiracy theories, but I'm sure people will have heard of them, and you can easily find them. So China, it originated in Wuhan, the province of Wuhan, and they had an immediate, incredibly strict lockdown where people were not able to go on the streets. It was a work from home kind of 3-line whip. Grocery stores, we saw this wide mask wearing. It was dealt with in a very, very strong manner. But a lot of people, a lot of right-wing commentators especially, critique that it was kind of a classic socialist country. You could never do that in the West. You could never shut down a whole region, never mind a whole country, and kind of strip people of these basic human rights of freedom and things. And this was a prevailing narrative that we saw. Johnson himself said that like a similar thing could just never be seen in the UK, obviously foreshadowing what did come. So with China's effective locking down and the sanitization of streets and things on an evening, and just this really strong message of how to kill the virus, you know, hand washing, mask wearing, not going out, it dealt with it well. And the virus didn't actually spread too much around China. There were, of course, reported cases in the big cities, as anyone would expect there to be, but it was largely contained within Wuhan. And over time, the economy has gone back to more of a kind of normal stretch. And I think famously, even though pretty recent history would show that New Year's Eve celebrations in Wuhan, there was no social distancing, there were huge crowds. And I think for some that left a bit of a sour taste that this is where it's originated from. But then equally, it does just show that they were effective on the whole. There were issues, the kind of whistleblower doctor that first reported on it, the Chinese court have actually come out and issued a public apology for his treatment. And there were a lot of similar examples of this that I think people are quite keen to capitalise on. But overall, you can't argue too much with kind of what's happened there, with the effective test and trace systems, with a kind of uniformly positive response by citizens to this. And yeah, it will be interesting. I'm sure people have their opinions, even just on whether the kind of deaths and cases reported are actually true, even, because a lot of people are saying that the place that it originated, when no one knew what the virus was like, it's unbelievable that there were just 5,000 deaths. But it certainly would be difficult to kind of have like a huge wide-scale cover-up. And again, we spoke about the Nightingales and their building in the UK. China did something very similar. They not only had hospitals for those most vulnerable and really struggling with the effects of COVID, kind of needing ventilation and things, that they had a kind of middle ground hospital area where people who were infectious and maybe couldn't necessarily effectively self-isolate in their homes without family members also getting the disease and spreading it in the workplace or at school, where those people were allowed to go and kind of return to normality. So it was a halfway house, and I think that was quite effective, and it's not something necessarily that's been spoken about a lot. So overall, China's handled it well, I would say.
Also, I just want to point out, I think China is the only country in the G20 to have their economy grow this year, or last year, I guess, 2020. I think it grew by 1.5%, or maybe it was 1.2%. But regardless, like much better than what we've seen in the UK, for example. So yeah, I have nothing much, to add to that. Apart from, China's obviously quite a difficult one because, there's a whole aspect of secrecy and things like that. But, as you said, I think it would be quite difficult to really cover up so many deaths if it was like that much more, for example. And I'm just anecdotally, for example, my cousin lives in Shanghai, and it's like, from what I can see, at least on his social media and stuff like that, they're not in any form of lockdown, for example. Like, they can pretty much live life normally. And, as Rachel was saying, in Wuhan, for example, they had those huge New Year celebration and things like that. So, yeah, overall, I mean, you can't really argue that their life's kind of back to normal. So, good on them, I guess.
Yeah, exactly. I mean, I think to all the, all the people in the West, especially, who the freedom lovers, I don't think they're thinking that when in New Year's Eve, when they were having the time of their life there in China, and we're just stuck at home, not doing anything. I mean, that is not to say that, obviously there is critique of the Chinese government and its repression, especially when it comes to whistleblowers, etc. But still, I mean, yeah, as you both said, it's hard to deny their success in, effectively fighting this disease. So yeah, I mean, yeah, that's not much to add. Sorry, not much else to add. I mean, I can go on to Vietnam now because I think that's also how they dealt with it is very similar case to China, and I think a lot of like such as we're not going to talk about South Korea, but they're also another country, for example, who dealt with it in similar ways, and it's just been a common theme within East Asia.
Also, South Korea, let me just add, really good test and trace system, for example. That like going back to the UK a little bit, but yeah, sorry about that.
Yeah, no, yeah, exactly. It's a very, they're actually one of the first models I think that truly stood out and people were applauding. But as we've seen over the past few months, also, China, as we said, Vietnam, Taiwan, etc. They've also been very effective in dealing with this crisis. But yeah, I wanted to focus on Vietnam because it's a country of over 95 million people, and as of right now, they've only had 35 deaths. Sorry, 35 deaths out of 95 million, which is crazy, and this shows how effective they've been. And I think overall there's been over 1,400 cases only. So yeah, just they boast a very good record, and it just shows that they've been very successful. And I think a lot of this trucks down to similar stuff to China, but it's just about proactive measures on all fronts, and unity within the government for deciding what actions to take. I think in this case, like a top-down socialist system, I mean, it does show that. I mean, obviously there's exceptions, but it does show that has been successful in fighting COVID. So yeah, I just want to quickly go through a bit of a short timeline with Vietnam and how they've dealt with it. So even before the first coronavirus case was recorded in the country, the government did do a risk assessment in early January, and so yeah, and then like a week before it was officially declared a public health emergency of international concern. They did close. They already shut down the borders within China because they share a border with China. So before it was even declared an emergency or a crisis, they shut down the borders, and visitors' temperatures were checked along the border. And I mean, if for example, if someone had to come in for emergency, they were checked, and also so they were also signaled out and isolated. So that just showed dealing with, especially in China, because only came around to the rest of the world a bit later on. So even before then, they were effective in dealing with the border with China. They received their first COVID-19 case on the January 23rd. And the day after, they suspended all flights from Wuhan, despite the World Health Organization saying there was no need for widespread travel bans as of yet. So as I said before, just very effective in doing that. And then on February 1st, they ordered more stricter border controls in general and visa restrictions. And then they also dealt with this a lot by locality lockdowns and just having effective tracing systems within the neighborhood. But yeah, it was more or less kept controlled. But by March, this cases started popping up with nationals that came from various countries. So by March 17th, they stopped issuing visas, and March 21st they closed their borders from not only from China, from all around the world. And they only allowed repatriation flights back to Vietnam, and then they had to, obviously like with China, they had to isolate in separately in a governmental isolation area. So that was also effective, and that shows in general these types of isolation prove to be more effective than home isolations because usually you share your home with other people, and that creates a more likelihood to spread. So they implemented that as well, but eventually they had to create a lockdown because the more and more cases started to pop up. So they implemented their first lockdown on April 1st, and it was a 15-day lockdown. And after the 15-day lockdown, there's still some regions that had to extend their lockdown because of new cases. So but by April 23rd, the economy was open, but masks were mandatory. And from there, they enjoyed a lot of 3 months of COVID free. They had no COVID cases, and that's an incredible feat. That's something that we never saw within Europe. So yeah, it just shows that effectiveness. And then a bit later on, it was around July. There was more cases. There's 500 cases recorded in 14 cities and provinces. But ultimately, the main area of the outbreak was the Da Nang region, and actually all the cases from the cities, from multiple cities across the country, were linked to. You could be traced back to the Da Nang region. So from the effective track and trace system, they were able to find the origin and trace it back to the city, and from there they implemented a local lockdown, so no one was allowed to leave that region. You can only come over for emergencies, as with other countries. And they also use like a pool sampling, which was we able to test 5 or 6 people together, like so a household could be tested. And the World Health Organization actually reported that a third of the city's households were tested in that region within 7 days, from September 3rd to the 10th. So yeah, so from that outbreak in July, they effectively, they isolated it, they traced it back to its origins, and they halted its spread very quickly, And then go back there in late November, so it's pretty recent now. There was someone came back from Romania who broke the lockdown rules, and they spread the infection, and they're actually facing potential jail sentences. And I think that you can kind of trace that back to the criticisms of China. But yeah, they just shows how strict they are in enforcing it. So in response to that, the selective commercial flights were stopped, and as I said, along with an effective tracing system, there's been no local transmission for a month from 1st of December. So it just shows the effectiveness of how they dealt with it, and apparently they say, despite having a state-owned media, and it's true that there's a lack of freedom of press, but in this matter particularly, they really communicated and wanted really a freedom of information for COVID-related matters, So, for example, one of the people within the government, the Communist Party of Vietnam, he contracted the virus on a trip to the UK. And they wanted to, in response to that, they published his whereabouts publicly so the whole country could see it. And just to give an example that, even the people within the party are, they following procedures. And you can compare that to like Dominic Cummings here in the UK, which is, he got they let him off just for breaking lockdown rules. So it just shows a bit of a difference, in guessing how society works. Yeah, and just to sum it up, I know it's been a bit of it's a long-winded, description, but these strict measures, and some people call it overcautious measures, have greatly benefited them economically. For example, according to the IMF, Vietnam is expected to grow the most in the world by 2.4%. So yeah, even ahead of China. So this shows, same with New Zealand, as you said with China, it shows that effective lockdowns and decisive proactive action does have, economic benefits, and has shown that these countries are going to perform the best by the end of the year. So yeah, it's an interesting example, and yeah, as similar to China, just there's a different mentality, I think, within the population, and also having to deal with SARS, for example. I think it's also changed the mindset of people, and this resulted into an effective management of COVID.
Yeah, definitely. Yeah, I think definitely these kind of other experiences with these other viruses, in some of these Southeast Asian countries has really helped them prepare for things like coronavirus. But yeah, anyway, so, Rachel, do you have anything to add to that? Or not really?
I was just going to add, kind of on the point of a different mentality, it's similar to what we've seen in Vietnam with that really effective test and trace system, even up to the uppermost echelons in the kind of party and the government. South Korea, the people in interviews and things, more Western journalists, a UK journalist from Sky News went over and said, okay, so you're willing to give up credit card statements, bank statements, kind of access to your phone location and things to enable this test and trace system to work. but where I come from, like, my country would never be okay with like sacrificing such freedoms. And the interviewee was really quite adamant that there was no like distinct cultural kind of dissimilarity between the two. It wasn't that people from the UK, you know, could just sacrifice these freedoms, or they couldn't sacrifice these freedoms, whereas people from South Korea, Vietnam, and so forth and so on could. It was just that they were willing to pay that price for a return to normal, for the kind of effective tackling of such a deadly disease. So I think it's really interesting, Samuel, what you were saying about that mentality, and it will come in time and time again in kind of comparison to some of those more Western nations who it just wasn't even on the agenda to have a test and trace system like that. You know, giving our details when we go into bars and restaurants like is seen as enough, and it really isn't.
Yeah, definitely. No, yeah, I definitely agree with that. Okay, so let's move on to Australia, I guess. So, if you are at home, sitting, listening to this, wondering how can this actually work, you know, in a more capitalist country? Although I'd like to argue with you that Vietnam and China are actually properly socialist. But anyway, so in somewhere like Australia, for example, you know, in the news you would have seen that Australia went through really intense lockdown periods. Melbourne, obvious example, 112-day lockdown, right? Massive. And, you know, not only did, you know, some of the states lockdowns and things like that, but the borders, so coming into Australia, right, similar to, you know, Vietnam, China, lockdown as well, but also kind of going in between states, you had to lock down as well. And so, yeah, basically, you know, the prime minister, in terms of like how the prime minister actually dealt with it, he formed a national cabinet with state leaders from all parties, and you know it was a really bipartisan approach. They listened to the science, and it not only resulted in only 28,000 cases kind of recorded in the pandemic, but also only 900 deaths. And in addition to this, right, you have a additional kind of government trust. So at the start of the pandemic, since the start of the pandemic, government trust has, you know, doubled, and this is coming from also a conservative government. So yeah, and I think it's important to look at Australia's you know, economic performance when discussing this, because you hear a lot on the news and I guess kind of in other you know, media outlets that you have to have a trade-off, right, between the economy and saving people's lives. And I guess as we've shown already, you know, through discussing this, that's not really true. And Australia is another example of this. So they didn't, you know, grow like Vietnam has or how China has, but in terms of, you know, in terms of like their actual kind of economic impact has definitely been not as intense as you would see in Europe. So, you know, Australia did go into their first recession due to these kind of restrictions and stuff, the first time in almost 3 decades. However, they are accelerating out of it. In the September quarter, the economy grew by 3.3%, which was much better than the predicted 2.6%. You know, quarter growth, and also the contraction in the economy at the end of 2020 was predicted to be 4.4%. However, it was only kind of 3.8 towards the end. You can compare this to the UK. You know, the economy shrunk 11.2%, and France shrunk 9% by the end of 2020. Right, so you know, not a real in-depth economic analysis, but it shows, you know, not as intense, right, as we see UK, France, etc. And economists, you know, around the world are linking this, you know, performance in the economy to, you know, controlling the virus and stuff like that. So yeah, you know, just more kind of similarities as you guys have highlighted, things like shutting down borders, things like test and tracing, things like stopping kind of, you know, counties or like states travel between each other to stop the spread and things like that. So, and at the end of the day as well, having a better economic performance.
Yeah, I mean, I think this, like, Australia and New Zealand are, you know, good case studies, you know, because I mean, as I said before, I mean, obviously the culture does play a bit of a role in your willingness to you know, look at the community, you know, as opposed to the individual. But I think Australia and New Zealand kind of blow that out the water a bit, because I mean, culturally, you can say like Australia, especially similar to how the UK, like the Commonwealth, is a bit similar in that sense. And yet, with common sense measures, as we've seen, because they did some similar stuff to Vietnam and China as well, and how to or more policies to implement to address it. Maybe it's not everything down to a T, but there are commonalities with these countries, and this has shown that it's been effective in dealing with the crisis in their country, So, as we said before, there is this at this stage is various examples that we can look to help the UK, and we just not listening, and I think these two countries provide a good example for that.
Yeah, I agree. I think in terms of how much we'll say about New Zealand, it's certainly been heralded as like one of the major success stories, along with Australia. Obviously, it's worth mentioning that the geographic makeup of New Zealand, say, compared to the UK, is sizable. New Zealand's population is minute in comparison to its geography and to the population of the UK and other countries that maybe haven't been seen to handle it as well. But that having been said, the policies that they enacted were replicated on countries with big populations, bigger than the UK. And so it's kind of with a pinch of salt that you need to talk about the geographical and kind of demographic differences, but it is of course worth mentioning, I think.
Definitely worth mentioning. Sorry, I didn't do that for Australia. But yeah, so Sad, you want to finish us off with Cuba, I guess, because they definitely have an interesting approach to it.
Yeah, I wanted to specifically talk about Cuba because I think it's interesting to see how they dealt with it, because they ultimately they have a set of circumstances which that most countries don't have to face, and but through I just wanted to talk about like how how creative they have been in finding solutions to these problems, and how the revolution and how Fidel Castro, how he set the foundations to address this crisis, So I wanted to start off with the Cuban healthcare model is very different in the fact that it's super localized, and it's a prevention-based model because, as you know, it's a country with limited resources, with U.S. sanctions that have lasted 60 years. So they need to be more about prevention than reaction. In Cuba, there's something called family doctors and nurses, and these are doctors that are based within the communities of around it could be like around 800 people, for example. So these are doctors that look after this particular neighborhoods. And for the coronavirus case in general, so the family doctors and nurses, along with medical students and local committees such as the Committee of the Defense of the Revolution or Combatants of the Revolution, who are local organizations that help neighborhood problems and address certain neighborhood issues. They all teamed up, and they kind of they went around and actively screened all the homes within the neighborhood for cases of COVID-19. So that involves testing and antibody testing. So so there's a mass mobilization because they didn't have high tech, so they really used manpower, and this kind of helps because they had the highest doctor to patient ratio in the world. So along a lot of students who are trained in this, so they were able to go door by door in the neighborhoods. And this kind of it's helped the tracing and isolation process that they undertook. So I thought that was just very interesting, like how these localized neighborhoods. All of them were. At the end of the day, it was a top-down approach in the sense that the government did provide the process that needs to be done. But it was just very much on a local level. So I thought that was interesting, and similar to the cases that we discussed before, it was an institutional-based isolation. So, and anybody who tested positive is hospitalized, and people who are suspected of carrying the virus were put into state-run isolation centers for 2 weeks until negative. this is also like currently this has been adapted slightly because they have open borders due to their success, and tourism is, you know, their main source of income. So they needed to open it up a bit. So when you arrive to Cuba as a tourist, you have to take a PCR. You have to first do a PCR test 72 hours before you arrive, and you have to hand that in. And then once you arrive there, you have to take PCR test as soon as you land in the country. And then you know, and from there you receive it, I think 48 hours. And then additionally, there is a government tax for based on bookings to travel there. So, I mean, despite opening up a bit, they are trying to decrease the prevention, you know. So I thought that was interesting, you know. And then I also want to talk about, you know, just the effect that the blockade has on Cuba and how they deal with it, and just to show how brutal blockades are for the average person, you know. So I mean, luckily, you know, due to this, you know, very localized family, you know, this localized neighborhood mobilization, they haven't overburdened the hospitals, but still, regardless, they have prepared for the worst case scenario. So yeah, they have had difficulties though, especially when it comes to ordering and fixing machines such as ventilators, because actually their main source of ventilators, which is in Sweden, was ultimately acquired by a U.S. company, and this, you know, this led to them not being able to order any more ventilation machines. So it just has created a whole complication, and the whole plan had to be restructured just because of acquisition. You know, it just shows how brutal it can be. So this led them to be more creative. You know, so for example, they had to do crowdfunding to collect phones, so that they can use the parts of the phones to create a ventilation machine. Along with that, they also did a crowdfunding for buying spare parts, so that they could buy spare parts to create ventilators. And how they created the ventilators was through open source design. So in their case in particular, they use open source designs from MIT and UCL to help create their own ventilators. So yeah, they really had to be creative, and you know, it just creates so much more complications for them. But it's pretty incredible how they did it. But I also want to add that you know, they've dealt with a lot of crises, specifically the dengue crisis that happened in the early 80s. And from that crisis, Cuba and Fidel Castro, they set up the Biological Front. And this is a collaboration between government, academic sectors, and research institutions, and was designed to coordinate to the needs and interests of various sections of the government, and also to form policy-making body that's capable of, you know, working towards a common cause between all these institutions, and implement, you know, biotechnology properly. So this biological front was also important in the research and development, and you know, to tackle the COVID crisis within Cuba. So yeah, I mean, just to close off, I want to show you a video of. I think the most interesting part is the community-based medical layout that they have. So as you can see, the video that I'll show you now, you can just have an idea of how it works.
Buenos días. Somos los estudiantes de medicina. Somos los estudiantes. ¿Cómo están? Muy bien, muy bien. ¿Todo bien? My name is Jennifer Hardy. I'm a third medical student. I started on March 10th, and we are doing it since today. We do it 100 houses per day. We go every day to the homes that we know there are people in danger. The first thing we do it is knock at the doors of our neighbors, and we ask them how they feel, if they have fever or cough or any symptoms that are from COVID-19 or some other sickness, because we don't only we are asking for COVID-19, so we are asking if they have maybe other respiratory sickness.
So yeah, as you can see from the video you just watched, yeah, even like you could see the two students there. They went out, they were knocking on homes just to make sure that everyone was, correct, and also they making sure to test them and make sure that they're all right. And yeah, I mean, I think it's just an exemplary way of dealing with this crisis in a country that's so has such little resources and the economic blockade. I mean, you can say what you want about. I mean, there is valid criticism, obviously, of the Cuban government. It's not a perfect government, but I think even the most harshest critics can say that how they formed their healthcare system and how they've dealt with this crisis was, I mean, very effective and an example of how you don't need the biggest and most expensive technology to deal with this crisis. So I just thought it was an interesting case study.
Yeah, it definitely is. Yeah, Cuba's always an interesting place to discuss because of all the history and stuff there. I was gonna say, Rachel, I feel like we completely skipped out on New Zealand. So if you want to add anything there with regards to female leadership and stuff like that, then please be my guest. I completely forgot about it. I thought after Australia, the Pacific is done, but it really isn't.
Yeah, no, for sure. New Zealand, it kind of ties in with this prevalent theme of female leaders making a real difference during the pandemic and the kind of gender parity within them, just having a more effective response to the pandemic. So if you look at Anna Solberg, Sanna Marin, Katrin Jacobsfear, Mette Friedrichs, who are all Prime Ministers of Norway, Finland, Iceland and Denmark respectively, the most successful handling of coronavirus can be seen in these countries as opposed to their male-led neighbours if you look to Sweden, the UK, Ireland. Now, obviously, it's a big argument to make that gender is the only thing that would kind of change a leadership and a response to the pandemic, when I think we've made quite clear it's dependent on a lot of other variables, whether that's kind of population, demographics or geography, or even just the finances and wealth that is available in that country. But I think the examples of some of those European leaders, obviously Angela Merkel with Germany is another key example. Nicola Sturgeon in Scotland. Scotland have seen high death tolls, but she has always been one step ahead in terms of the lockdowns, even just compared to Johnson, kind of south of the border. So this really is encapsulated by Jacinda Ardern and the New Zealand COVID response. This kind of humility that has been seen, the economic reliefs and just kind of furlough schemes and things has been incredibly effective, with just 1 or 2 confirmed cases in major cities. I think one of the most effective ways has been the fact that they have then immediately locked down. And of course, this has been replicated with countries with male leadership. It's not hugely a gender issue, but I think it would be folly not to at least recognise it and kind of comment on some of the areas, because the record kind of doesn't lie. Just as we were saying with the UK, as much as you can say the government have done the best that they can, and it's all very well to remark with hindsight, but overall the deaths and cases don't lie. I think that's similarly apparent for the countries with female leaders and their pandemic responses. I don't think you can call it kind of just a coincidence. So New Zealand has been heralded as the key example, and Jacinda Ardern, I think there's certainly like a very popular cult of personality around her leadership. So I would encourage people to look at other maybe European countries also with female leaders and the kind of similarities in their responses. But yeah, overall it's certainly a good point for women in leadership positions kind of always needing to prove themselves. This, I think, we can certainly take as a victory for those prime ministers.
Yeah, it is also interesting to like see the idea of the strongman leadership and all this kind of stuff decay away when it comes to this pandemic. And it's nice to obviously see some more of the women leaders really step up to the plate, much better than a lot of their kind of male compatriots or whatever you want to call it have. So yeah, definitely a positive there. So I think we're gonna round out the show by looking over some of the vaccine distribution strategies and stuff like that. Rachel just mentioned kind of New Zealand, so I guess we'll start there. From what I've seen in research, New Zealand and Australia are doing a joint approach with regards to vaccine distribution within their own region, the Pacific region, targeting places like Cook Islands and Samoa. So also, on the more economics side, it makes sense that they're doing these kind of vaccine distributions to surrounding countries, because obviously places like Australia, places like New Zealand, they benefit a lot from tourism. So as soon as these kind of countries surrounding them can get high levels of vaccinations, then they can also benefit from that tourism industry once more. And also with regards, obviously, to their own countries, they're kind of rolling out vaccine distribution. I believe in Australia it's starting in March, and I believe it'll probably be something similar for New Zealand. So yeah, just to mention it, because we want to have some light at the end of the tunnel with all this coronavirus shebang. So yeah, good to just mention at least. Samuel, do you have anything to add for some of the other countries, or Rachel as well?
No, not much else to add. Yeah, as you said, I think it's great that New Zealand they have a good approach to this vaccine distribution. Looking after their neighboring countries in the Pacific. But yeah, I think overall globally, as the dynamics of vaccine distribution, I think in some ways it does mirror the current fight, I could say, for global power. So we can look at the major countries, like for example, as a side note before, I think the UK recently struck a deal with India so that India can produce the Oxford and AstraZeneca vaccine there, and in turn they can also India can distribute those vaccines themselves to developing countries. So I want to be fair to the UK that there is an effort to for more equal distribution on their part at least. But looking at a country like the US, for example, there's been there's been a lot of articles actually recently called vaccine apartheid, and how there's been such a unfair distribution of the vaccine in the global north compared to the global south. And you can even see I think we can pull up a chart now that shows that it's estimated that Africa, for example, most countries in Africa will only receive it in 3 or 4 years' time. This just shows just initially, I think it doesn't make much sense, because to effectively combat COVID, I think you need a global response. You need countries around the world to be able to have the vaccine, so it limits the spread in the future. So I think that just is obvious, and it just shows. I think it just shows a lack of global coordination in distributing this. But I will say that for example, China, for example, they've developed their own vaccine, and they're going to be part of this organization called the COVAX facility, which is the global alliance of 189 countries, and it's kind of moving towards equal vaccine distribution. So I think obviously, they have strategic implications there in distributing for themselves, but be interesting to see the dynamics if, for example, China if they are more willing to distribute their vaccines to the global south, or if Russia is distributing the Sputnik vaccine to other places as well. So I think it's still to be seen, but there's definitely a dynamic where the US especially is prioritizing vaccines for themselves and Western allies, and creating a kind of a gulf between global south and global north countries. But there are countries like China and Russia, strategically or not, they are, I guess, working with countries that have less income to buy the Pfizer or Moderna one. So yeah, I think it'll be interesting to see. Yeah, what are you guys' thoughts on it?
Yeah.
Yeah, I mean, on my side, oh, Rachel, go for it.
No, it's fine. You start.
All right. No, yeah. I think it's important to have a lot of these, conversations around vaccine distribution and manufacturing, patents as well. For example, um,
Yeah, I was gonna say I think
and
it could be a good one to like discuss more in more detail in another episode, for example, about the
yeah. I
patents.
mean, just a brief note on patents, like things like the Moderna vaccine, almost, I think, I think it was almost 80% funded by government, or even more than that. So, and then it's Moderna, although they have, opened up the patent, so I guess they're not really making money from it. The COVID, vaccine itself right now, the technology which has, gone into a lot of this government funded research and development, stuff like that, is something which they will benefit off in the future, right? And it's not just Moderna. There's multiple other vaccines which have received tons and tons of government funding, which are then eventually gonna make a lot of profit off this. And it's a mix of, in my view, I guess, more greedy kind of corporations in some sense, and also really bad government policy, right? If government's funding 50% of this R&D research, for example, and it's going to be really useful in going into, some form of patent to be made, like to make loads of money off of in the future, then this should be something which the government should have a certain percentage of, or something that they get should be entitled to a certain percentage of the profits, right? So I mean, that's just how I would see it in my view. And in terms of actual vaccine distribution, I think it's also really interesting how you see as you've mentioned, China, Russia, you have New Zealand, stepping up to the plate really, and trying to distribute this to kind of other countries and things like that. I think sometimes this whole vaccine distribution thing brings out the worst in the world. Like we see how everyone it's like, the idea of it's me the whole time, like have to get it for my population at this time. We don't really take a step back and focus on, other people and kind of their conditions. And also, I can understand how, a country wants to vaccinate its populations first, right? Sure. But you can also, set aside some of it or buy a certain amount of vaccines to give abroad, like we see in New Zealand, for example.
Yeah, it just doesn't make much sense, I think, to not try distribute it as widely as possible, because we do live in a globalized economy, and if there's disruptions within the supply chain within the global south, for example, that's going to ultimately affect the global north and their economic situation. So I think it doesn't make much sense just to focus on yourself, because in the reality we live in, this does as ultimately could be useless, So yeah, I mean, as you said, it brings out the worst in people.
Yeah, for sure. I think, as you were saying, kind of in such a globalized world and kind of global economy, it's only going to have a kind of chain reaction, like a knock-on effect from one nation to another if the vaccine isn't widely available, or different strands and different types. But I think it's certainly interesting as well, the kind of China and Russia narrative in terms of their own motivations for really making that as widely available. There's certainly political capital to be had from it. There was even just small political capital with kind of the UK being one of the first to roll out the vaccine back in December. But yeah, I think certainly to end on a brighter note, it's certainly a really, really good thing that the vaccine is kind of coming more widely available, and hopefully with time we'll see a kind of mass vaccination of the world's population. But in the meantime, as each country maybe does their own response, even just from a regional perspective, I think that may be the way forward for a lot of places. Like if you look at those Pacific regions and so on and so forth, like a European Union-wide kind of response, then I think that may in practice be the most practical, whereas in principle it would be nice if there was this nationwide rollout.
Yeah, I mean, yeah, exactly. I agree with you, and this kind of like draws like the attitudes towards China and Russia, like it kind of draws parallels to me, but like the skepticism around Soviet Union helping liberation movements in Africa, for example, in the in the 20th century. And yeah, I mean, obviously this to be said, like everyone has their own strategic, plan in distribution. But yeah, I mean, I think there's a bit of a double standard when it comes to countries like Russia and China, just assuming the worst, and while completely overlooking how we distribute in the vaccine. So yeah, it's interesting. It's interesting dynamics for sure.
Yeah, definitely. And so, I mean, I have nothing else to add, really. Do you guys have anything else to add? No? Yes? No? Okay, well, it seems like we've reached the end of Systems Reimagined, episode 1. Again, as I said at the beginning of the episode, if you enjoyed hearing our views, perspectives, things like that, like, subscribe, share, helps us grow, and things like that. And we'll see you guys all very soon.
And in the link in the link in the
Nope,
bio,
no worries.
you have our social media handles where you can follow and just
Yes, how could I forget?
Yeah.
I forgot, yeah, how could I forget to mention the bio? Social media accounts.
Just
Go,
to
Rachel.
add, in terms of, we really appreciate, like, we've had some followers right from the beginning. We've kind of privated a few of our earlier videos, and this is going to be the first one of kind of the official launch. But we really appreciate, we've had some like really consistent viewers over the past few months since October. So whether you're kind of an old viewer or a new viewer, we really appreciate the watch and hopefully the subscription too.
Yes, absolute legends. Okay, we'll see you guys all very soon. I've been Benji, joined by Rachel Samuel. See you all soon. Bye-bye.
See you.
Bye.